Okay, welcome everyone. We're going to get started. Welcome to today's Health Policy Institute webinar on the impact of COVID-19 on the dental care sector, where we're looking at the latest insights from the latest data as of the week of September 7th. My name is Marko Vujicic. I'm the Chief Economist and Vice President of the Health Policy Institute at the American Dental Association. I will be chairing today's webinar. We have three areas of discussion today. One is an update on the latest data from HPI's Economic Impact of COVID-19 tracking poll. Hopefully many of you have been with us every 2 weeks where we're out in the field collecting new data. You'll see the freshest round of data from the week of September 7th in this webinar. We also have a series of questions of the week that we're relating to COVID testing, COVID vaccines, as well as financial relief programs from the government. So this is new, fresh, never before seen data. And finally, we're also going to review the latest consumer sentiment data collected through our partnership with a leading consumer insights firm. And we're going to look at how the population is viewing dental visits at this stage of the pandemic. Before we get into our introducing our panel, I do want to just go over some quick housekeeping. This webinar will be recorded. The slides will be available. In this round, we are not doing any live Q&A. That's different. We've got a lot of questions ahead of time from folks that have registered for the webinar. We have a lot to go over, so we decided this round not to do live Q&A, so you will not see a Q&A box as we usually have. That is on purpose. But you will still see a chat box where you can basically raise any technical issues you're having or problems you're having. The HPI team behind the scenes will help you out. So just to review again, recording will be available, slides will be available. We are not doing live Q&A. We've gotten a lot of questions ahead of time from audience members who registered. And with that, I'm going to go ahead and introduce our panel. This is a wonderful group of thought leaders, and we're very privileged to have a great panel today. We're going to start with a presentation from Chelsea Fosse, who's a senior health policy analyst at the ADA Health Policy Institute. She's in our team here. So Chelsea will do a quick walkthrough of the latest data, and then we're going to open it up to a panel discussion. We have four great panelists. We're pleased to have Battrell. Anne is the CEO of the American Dental Hygienists Association. It's been great to have her finally bring some of the insights from the hygiene world to our policy debate. So thank you, Anne, for joining us. And you'll see all these panelists a little later live. I'm just going to do quick intros now. But again, you'll see us all live in shortly. We also have Candice Chen. Candice is an associate professor of health policy and management at GW in Washington, D.C. Before that, she was also at the Bureau of Health Workforce at HRSA. So great to have you, Candice. Mike Graham is known to all of you, hopefully. He leads our DC office. He's the Senior Vice President for the Division of Government and Public Affairs at the ADA. He's been one of the busiest people in dentistry the last couple months, working hard on Capitol Hill. So a pleasure to have Mike with us as well. And Roger Levin rounds out our panel. Roger is the CEO of the Levin Group, which is a dental management consulting firm. He has numerous accolades in this world, including being recently named one of the best dental consultants out there. So it'll be great. We'll see us all shortly. I'm going to soon hand it over to Chelsea. Chelsea's going to review the latest data from our HPI tracking poll. Hopefully this is familiar to many of you, but here we go. We've had biweekly polling since early March. We have core data related to how many dental practices are open, what the volume of patients looks like, etc. We have questions of the week, which Chelsea will walk you through this week. The point is very large, very stable, nationally representative sample of dentists. And if you go to ada.org/HPI, you can get the full report. You could look at a state level dashboard that's very interactive, easy to use to look at state level data. But today, Chelsea's going to walk us through the highlights. So just once again, use the chat if you have technical issues. HPI team can help you out. Do not use, we don't have any Q&A box. Do not use the raise hand function. We're not taking questions today from the audience. And all this will be recorded and the slides available. With that, I'm going to hand it over to you, Chelsea, to walk us through the latest data.
Great, thank you, Marko. So let's get started with some of our core questions. We've asked, what is the current status of your dental practice? Each bar here represents a different wave of our biweekly polling, and the most recent data is in the bottom bar, representing the week of September 7th. So you see that the green indicates practices that are open and reporting business as usual. Yellow is open but lower patient volumes. Orange is closed but seeing emergencies, and red is outright closed, not seeing any patients. As of last week, nearly 99% of dental practices in the US were open. You can also see that there hasn't been a significant change in the past few waves of polling. So these figures have remained unchanged and are stabilizing. We've stratified this data, oops, sorry, if you can just go back for 1 second, thank you. We've stratified this data also by practice size and affiliation with a DSO or dental service organization. The results aren't shown here, but they'll be available at ada.org/HPI. We saw that group and DSO affiliated practices are more likely to report that business as usual in terms of patient volume. Next, we asked, how does this week compare to what is typical in your practice in terms of total patient volume? So going from left to right in these bars, the purple, red, orange, and yellow all indicate patient volumes of less than or up to 50% of what is normal. The light and dark green indicate patient volumes of 51 to 75% and 76% or more, respectively. Patient volume as of the week of September 7th is estimated to be at about 74 to 81% of pre-COVID-19 levels. Again, there hasn't been much change in the recent waves of polling, so nationally these patient volume numbers seem to be leveling off. Then we asked the following of owner dentists. Is your dental practice paying staff this week? Green indicates yes, fully. Yellow is partially paying staff, and red is not paying any staff. Staffing in dental practices is stabilizing as shown and is at 94% of pre-COVID-19 levels as of the week of September 7th. Among non-owner dentists, we asked, are you being paid this week? And if not, are you currently receiving unemployment benefits? The top graph is pay status among non-owner dentists. We see that green bar that indicates being paid fully accounts for just under 80% of the responses. You'll recall in the last slide that owner dentists indicate staffing at 94% of pre-COVID levels. So there's clearly a difference here. There seems to be a lingering unemployment effect for non-owner employee associate dentists persisting as of the week of September 7th. The bottom graph indicates the status of unemployment benefits for those who are not being paid at all. Among these non-owner dentists not being paid, just over 1/3 were receiving unemployment benefits as of the week of September 7th. Here we have data from the Bureau of Labor Statistics. It's showing that employment in dental offices, the green line you see there, was at 96% of pre-COVID-19 levels in August. So this is in line with the data that we're getting from the HPI polling as well. We've been surveying regarding PPE supply as well. We asked how many days worth of the following PPE does your practice have at this time? The categories of interest include N95s, surgical masks, face shields, gowns, and disinfecting supplies. Red indicates no supply, orange is up to a week, yellow is 1 to 2 weeks, and green is more than 2 weeks. That small sliver of gray at the tail end is for those who aren't sure, which could perhaps be our non-owner dentist respondents. Comparing this to past waves, though not shown here, we see that PPE availability in dental practices has been stable over the past month. Gowns and N95s remain the biggest issue for practices, as well as disinfecting supplies. All right, so now let's jump into our questions of the week. These will all look new for those who might be repeat attendees. The first question asked, have you applied for funds from the following relief programs? The HHS Provider Relief Fund, the Paycheck Protection Program or PPP, the Economic Injury Disaster Loan or EIDL, private dental insurer relief funds, or none of the above. About 93% of dentists applied for some form of financial relief. The most popular programs have been the PPP, Provider Relief Fund, and EIDL. Dentists in solo and small group practices were more likely to apply for these programs than those in large group practices. And again, that's shown in the full report that's available online. Our team wondered if dentists who participate in Medicaid would be more likely to apply for the Provider Relief Fund than dentists who do not participate in Medicaid. So we reran the figures shown on the previous slide, separating the dentists who participate in Medicaid, the purple, from those who do not participate in Medicaid, the green. As you can see in that first set of bars for the Provider Relief Fund, Medicaid providers were slightly more likely to apply for the Provider Relief Fund. Among all dentists who applied for any relief program, we asked about the current status of their application. The green indicates approved, red is not approved, and yellow is awaiting decision. The vast majority of applications were approved as of the week of September 7th. Some are awaiting funding decisions for the more recently enacted programs. You can see the yellow up top, 20% are awaiting response for those who applied for the Provider Relief Fund. And that application deadline just passed over this past weekend. And 13% of those who applied for private insurer relief programs are still awaiting response. Going back to the Provider Relief Fund again, we asked those who did not apply why. What were their reasons for not applying? Did they not know about it, think the amount was too small, thought the application process was too complicated, thought they didn't qualify, or were they concerned about government oversight with this? So the most common reasons for not applying were that they did not know about the program or did not think that they qualified. For the most part, with very few exceptions, all practicing dentists were eligible. That other block at the bottom included those who specified that they didn't want or need the loan, that it wasn't their decision, so perhaps non-owner dentists reflected here, that they received other funds, or that they planned to apply. And a handful of folks did have a few more days to get their application in as of their response date last week, which is now passed. Again, we compared the reasons for not applying to the Provider Relief Fund between dentists who participate in Medicaid, the purple again, and those who do not participate in Medicaid, the green. Non-Medicaid providers were more likely to report that they did not know about or thought that they did not qualify for the fund. Medicaid providers were more likely to indicate that the amount was too small or the application process was too complicated. All right, next we'll get into COVID testing. We asked our panel, how important do you think it is to have rapid point of care COVID-19 testing for your patients, your dental team, and yourself? The light teal on the left portion of these bars represents extremely important. Then as we get darker and move to the right, that indicates very important, moderately, slightly, and not at all. About 2/3 of dentists think it is extremely or very important to have rapid point of care testing for their teams and themselves. The availability of testing for patients in the office was of slightly lesser importance. We stratified these results by DSO affiliation, practice size, and age group of the dentist. And we found that dentists who are affiliated with the DSO, practice in large groups, or are in an older age category believe it is more important to have rapid point of care COVID-19 testing available. Our panel of public health dentists also responded to these questions the week of September 7th, and here we're comparing these two panels, the private practice panel and the public health panel. On the left, you see patients, dental team, and yourself as the dentist. And on the right, you can see that the top bars in each of these three sections represents our panel of private practice dentists, while the bottom bars in each of these areas represents the respondents from public health. Again, those lighter shades of teal displayed in the first portion of the bars are those that believe point of care rapid testing is extremely or very important. So what we see here is that dentists in public health settings are placing a higher importance on having testing available compared to those in private practice. Also, if you compare those bottom bars in each group, patients, dental team, and yourself, you'll see that there's parity among the importance placed on testing for those three groups, patients, dental team, and the dentist. Then we asked about the prospect of vaccination. So assuming that dentists in your state were permitted to do so, would you be willing to administer COVID-19 vaccines to patients in your office? Green is yes, yellow is maybe, red is no. In that top bar, you see 44% or less than half of dentists would be willing to administer COVID-19 vaccines to patients in their offices. There are slight variations by DSO affiliation and practice size, where dentists in large groups reported they are more willing. There wasn't much variation based on age of dentist. We stratified this information by specialty, and this represents that same question. Assuming you were permitted to do so, would you be willing to administer vaccines in your office? On the left here, you see the specialty abbreviation indicating each different bar. And periodontists and oral surgeons are the most willing to administer vaccines in their practices, followed by GPs. And prosthodontists and endodontists seem to be the least willing. We compared our panels of private practice and public health dentists again on this one. Would you be willing to administer a COVID vaccine in your office? Dentists in public health settings would be more willing to administer vaccines compared to those in private practice, as you can see by that larger share in green on the bottom bar. And that concludes our polling data for the week of September 7th. Before we get to the panel discussion, we have just a few items to share from a household survey that reflects consumer and patient sentiment regarding the dental visit and associated questions throughout the pandemic. We've been partnering with Hygienists, a leading consumer research firm, to explore these items. The data shown here are from a nationally representative sample of households. To gauge readiness to return to the dentist, Hygienists has been asking which of the following conditions is closest to your current point of view regarding visiting a dental office. This question was posed only to those in their panel who indicated they had visited a dentist in 2019. So these are dental utilizers. They're the folks who we would typically see in our chairs. If you look at the dark green on the top left, That roughly quarter or so folks are those that have already been back to the dentist. They've recently been active. Then on the right side of this pie, we have the 55% who say they're ready to go. That yellow sliver is assurance seekers. Those are folks who need a bit more comfort, some sort of reassurance from national or local authorities, perhaps the CDC, ADA, or even their local dentist before they'll be back to the dental office. And then 14%, that piece in red, those are folks who will need a medical breakthrough. They won't be back until there's a vaccine or a proven treatment for COVID-19. So what does this tell us? If you remove that red piece of the pie, those who aren't willing until there's a breakthrough, and add up the rest, then we get to about 85%. So our upper bound on return of patient volume is roughly 85% of pre-COVID levels. If I can jog your memories back just a few minutes where we were looking at patient volumes, and we're estimating our range now to be about 74 to 81%, we're clearly approaching that upper bound. And lastly, consumers were also asked, from which of the following sources would you be willing to get a COVID vaccine once one becomes available? We start on the left with high willingness among consumers to receive a vaccine at their doctor's offices. That's followed by the pharmacy. Then we get to workplaces, grocery stores, and then dentists. So 13% of consumers indicated that they'd be willing to get a COVID-19 vaccine at their dentist once one becomes available. We'll be doing some follow-up work on this and diving a little deeper into this question and patient and consumer thoughts about vaccination in dental offices. Here are some takeaways that will be available when the slide deck is posted online and the recording is available online in the coming days. I'll turn it back to Marko so we can get to the panel discussion that everyone's been waiting for.
Wonderful, thank you. Thank you, Chelsea, for that great overview. Just gonna leave this up for a sec. So again, the slides will be available so you can read in detail our big picture takeaways. There's 5 of them. Chelsea did a great job of walking through our kind of questions of the week. We're going to discuss those in detail. And again, we're not going to be taking live Q&A. I have a series of questions that were submitted ahead of time from our audience who registered, as well as some of my own. So with that, I'm going to ask our panel to start your videos, unmute yourself. Let's bring everybody back. There we are. Okay, wonderful. So just to orient the audience again, Ann Battrell, who's the CEO of the American Dental Hygienists Association. Just raise your hand, Ann. Thank you, welcome. Candice joining us from GW. Candice, hello. Mike Graham, there you are. Raise your hand from our DC office. There's Chelsea, our wonderful presenter today. And rounding us out, Roger Levin, the CEO of Levin Group. Great. Okay, thank you all. So here, are we seeing everybody? Okay. All right, let me start with the first question. What surprised you, or what really confirmed your beliefs or what you're hearing from the field? So can I start with Ann on this?
The yes, I'm seeing that part is the 99% of practices are back to work. We're definitely hearing that at ADHA. One of the most concerning things from our community is the availability of PPE. Most notably right now is the disinfecting supplies, masks, and gowns. Those are big factors when hygienists are making a decision to return to work, as if they feel safe, as well as their families and loved ones. So those things confirmed what we're hearing. The most surprising thing to me, Marko, was the data differences between large group practices, DSOs, and private practice, especially on the rapid point of testing data that you shared. We can see that there's pretty significant data differences from those types of populations.
Okay, great. Let me bring in Roger. Same thing. Big surprise or big confirmation?
Well, as you and I talked about, we have a 24-month recovery timeline model, and we're just in the end of September, we're going to move through this first phase of pent-up demand. So a lot of practices have not been as concerned about patients returning as I think they will be in the second phase when the pent-up demand has been completed and practices slow down a little bit. So we've been projecting that about 18 to 20% of patients will not be coming back in the near future. And when we take the data that was showed today by Chelsea, that around 15% or 13% of patients are not coming back, and another 7% need assurances, that was one that confirmed what we've been projecting in terms of practices. So that was really interesting. In terms of dentists wanting rapid testing, I'm not surprised at all. I would think it'd be relatively high for doctors and staff and then patients. So as we move into this second phase, I think we'll see some data shifting, but a lot of what was shown was confirming what we're seeing amongst hundreds of practices throughout the country.
Okay, very good. Mike?
Well, I actually, the statistics about the number of dentists applying for PPP and EIDL and provider relief was really interesting to me, because actually HHS has not released those numbers. So to see that 90% applied for the PPP, I think is very telling. I am a little bit surprised by the provider relief. I hope that really isn't 61%. It was a great opportunity that dentists could take advantage of for the good of the practice and the dental team. And we pushed hard for HHS to extend the date. Originally, it was supposed to end in early August. We got them to extend it till the end of August, and then again to September 13th. And so I hope dentists took advantage of that, and that number is really higher than that.
Okay, since we're on it, before getting to Candice, Chelsea, just refresh us, top 2-3 reasons why dentists said they didn't apply to the provider relief fund. They were?
Sure. The top 2 reasons were that they did not know about the program, or they thought that they did not qualify.
And Mike is laughing, but we're both like, there's no excuse for that.
Well, Ann knows better than anybody that, we flood our inbox, our members' inboxes, and,
Exactly.
and we did that, didn't we, with that particular issue. And in fact, my staff and I kept saying, geez, how can they not know? It's got to be close to 100%. So you're absolutely right. I was surprised by that. Now, unfortunately, I will add, Marko, that when this came out, there unfortunately, and maybe Roger knows this as well, there were a lot of rumors about
and confusion,
about provider relief fund and would it impact payment of in other areas. So we had to get to the Q&As out on that so that they understood it did not.
Well, your team did a great job, so I'm like, no excuse. Roger, just before you chime in, Candice, give us your quick reaction here.
Well, to follow up on that, I actually really appreciated the fact that you broke out the Medicaid providers to the non-Medicaid providers. And it really did strike me that if I recall correctly, one of the reasons that your Medicaid providers were reporting not applying was that the amount wasn't sufficient, which sounds ominous to me.
Right. Okay. And while we're on that, what, Mike or Chelsea, what's the amount? I know it's a % of your typical charges, but either Mike, can you chime in on this?
It's 2% of your gross. So every practice is going to be different. Okay.
Yeah. So. But to Mike's point, I think there was a lot of confusion early on. Well, if I'm not a Medicaid provider, am I eligible? And the answer is yes, right? And then will I have to accept certain rates if I apply? No. So Mike, you guys did lion's share of work there, really trying to get the word out. So I don't know what more we could do, but it is what it is. The data are the data. We'll learn from it. Okay, let me now dig in. I want to tease out a little bit the results related to vaccines, and both what you all saw from the provider side, from the dentist side, in terms of willingness to be providers, but also what appeared to be a very small share of the population that at least now says they'd be willing to get a vaccine at a dental office. So if I maybe start here, let's go over, if I start with you, Candice, I don't know, what are we to make of this? Are we in a world where, is it feasible in 6 months? Eventually we will have vaccines at some point, that dental offices meaningfully participate in that kind of immunization effort? What's your big take from those data points?
I thought that the question was really interesting. I thought that the willingness of so many dentists to provide vaccines was very important. And what it also says is how much work there is to do in order to be able to roll out a vaccine, which we hope at least within the next 6 months, next year probably. But the amount of work that it's going to take to figure out everything from how do you distribute it, where do you distribute it, and who's going to provide it. And what it suggests to me is right now is the time to start engaging in these conversations. The fact that 13% of the population, thinks of their dentist to go get a vaccine, I don't think that's a barrier. I think that it just means that we have some work to do, and we have to be strategic, and we have to look at who are the different providers in the community. And I think that we're already getting senses that people are grappling with these things. I know that there are states that have legislation and that specifically allow and support dentists to provide vaccines. Not many. I think it's like 2 or 3. Oregon passed a legislation maybe last year. Illinois. Pharmacists provide vaccines. And state by state, there were different restrictions around it. And we saw a really interesting thing happen just this past August, where HHS actually used their emergency authority to intervene and basically override state scope of practice rules to say, we're authorizing dentists to be able to provide childhood vaccines, slightly different, but you suspect that they're looking at childhood vaccines a little bit more closely with the COVID vaccine soon to follow, right? And so HHS used their emergency authority basically to override state scope of practice rules. So we know that there is interest. We know that there is action in these areas, and we know that it's going to probably come both from the federal and from state activities. But one of the other things I would point out as well, though, is I think that community by community is going to look different, right? If you have a community where you have a lot of healthcare providers, you have a lot of pharmacists, your pharmacists are engaging in providing vaccines, that the role of a dentist in that community might look a little bit different, right? It might be about public health, it might be about education, it might be about role modeling. But in certain communities, your dentists are probably very critical healthcare providers and very critical in the healthcare system. And so in different communities, we might actually need the flexibility to do different things.
And Chelsea, just to confirm, that was asked of the whole public, not just those that go to the dentist. So there's probably folks answering that say, well, I don't go to the dentist regularly, so I'm going to check no. Am I right? Okay.
Yes, that's correct.
So that probably affects some of the results. Sorry to cut you off, but thanks for confirming. And what about like from the hygienist standpoint? Like I'm thinking obviously injections in the mouth, again, I'm not a clinician, right? But they're different than injections in the arm or the thigh, right? Is it feasible that the hygienist administers a vaccine if it's in the arm?
Yeah,
is this something on the radar? Or?
Yeah, I think that'll be a very high priority for the dental hygiene community. We're only down to a handful of states that don't allow dental hygienists to administer local anesthesia.
Oh, okay. So
what I would share with the participants today is we will be doing a study of the dental hygiene community with the HPI very soon. So we'll have the opportunity to ask these types of questions of the dental hygiene community so we can look at the parallel with the dentist data that you've collected. I think the natural tendency is going to be a scope of practice issue that's going to emerge in the states. So I would hope during the pandemic time that we could see the dental and dental hygiene community come together over the vaccines, especially the point you raised about people who don't even have a dental home. And where are they accessing vaccines is going to become really important. So I think we've got a big opportunity to look at the hygiene community fully participating in the vaccines and get some data around that.
Okay, great. Anything quick to add, Mike? Or we can move on if not.
I know it's being discussed right now in Washington about how they're going to do this, and I know our Kathy O'Loughlin, ADA's executive director, actually testified earlier this month, and I know Ann's group weighed in as well about being able to receiving the vaccines.
Yeah.
So I'm sure all that discussion is they're probably taking all that into account.
But good, we're weighing in, and so is the hygiene group. Good.
Right.
Ro, quick, anything before we move on from this issue?
Only that in terms of whether dentists or hygienists would be administering vaccines, there are two versions. One would be the hygiene patient who's there for their appointment, they want the vaccine. If it's open to more patients than actually go to that practice or go to dentists, it's going to be very disruptive to dentist schedules. And that's something they don't really know how to handle. Having 50 patients waiting in line to get a vaccine is not something dental practices would be used to.
Right, which is different than if it's in conjunction with an appointment where you're in the chair already, and presumably it'll be a smoother thing. Okay, great point. Okay, so I want to first thank all the participants who submitted questions ahead of time. Chelsea was kind enough to kind of help me filter them, but let me get to some of those. So one was this issue of financial outlook, and let me break it down. And Mike, let me start with you. So generally, we want to talk about the financial outlook for the next 6 months for dentistry, but let's specifically say what's on the horizon in terms of additional financial relief programs. Obviously, the data Chelsea showed indicated, look, dentists access this, and it was important, and research we've done showed it actually helped avoid layoffs, right?
Right.
What's the future look like here? And I know it's hard, but you're the one with the most knowledge, so help us out.
Well, as you know, and I think probably a lot of the folks tuning in know, they've passed 4 COVID packages, legislative packages so far. The 5th one has been elusive, in part because as we move closer to the elections, it's become a political football, and there's a package that was passed by the House earlier this year in May called the HEROES Act, and that is very comprehensive, and it's quite large. And then there's the Senate version that came to the Senate floor last Thursday that is a much smaller version of that. So and that didn't even pass the Senate, but yet Congress continues to talk about this. Nancy Pelosi just came out yesterday and said that the House is going to stay in until they pass something. So again, there's some politics involved in it, but both the packages contain things that I think the dentists would like, and that we've been actually advocating for, and that's second round of PPP for those dental practices that might need that, allowing PPP to be used for PPE. Excuse me, folks, but that's what it is. Is simplifying the PPP, if you will, audit process so that it's basically one piece of paper, especially for those that took out less than $150,000 worth of PPP. So there's a number of things that are in there that would benefit dental practices, I think, substantially, and we'll continue to fight for those. But at this point, I would, in my crystal ball, Marko, I'd say it's not going to happen before the election. It's probably going to have to wait until after the election. And even then, it may depend on the elections and whether or not we have status quo or whether or not we have somebody new coming into the White House or taking over the Senate and so forth. So again, it's stay tuned.
So Roger, you obviously are dialed into dental practices, finances, right? So let's go on the assumption we don't have additional financial relief, right? If we go on that, and you talked about, and Chelsea's data showed, right? If we're looking at a steady state of 80 to 85% of typical patient volume, what does that look like for the finances of dental practices, let's say over the next 6 months? I mean, are we talking closures? Are we talking acquisitions? Are we talking, no, it's doable with 80% demand? Walk us through some of the issues.
Yeah, well, as we move through this first phase, which is June 1st and going out 4 months, everybody's been so focused on pent-up demand that they haven't been worried about what happens next. We believe, as I said, that starting in October, and again, these are projections, they could certainly be inaccurate, but based on everything we've seen and research data back to the 2008 and 9 recession, we believe that practices are going to decline in production in the second phase, on average, somewhere between 15 and 20%. And that's an internal model that we've built based on the patient volume plateauing at about 80% and having somewhere around 15 to 20% of patients not coming back over the next 6 to 24 months. So based on that declining production, if there's no more government assistance, we do think we're going to see a rise in the number of practice closures and a more dramatic rise in the number of mergers or acquisitions. But a lot of those will be based on the practice not performing well and just looking for an exit and the dentist either retiring or looking for another position.
Okay, and Chelsea, just confirm, we have not seen lots of, like you were saying, 99% of practices have reopened, right? And we have basically very little, even like early retirement or people not going back to work. Am I right?
Correct. I think
Okay.
a wave in the past, we had looked at the possibility of those exiting from the profession early. And we don't have updated figures on that, but at the latest point, I think it was a very small number, like 1%. And now even it doesn't seem like that's reflected in what we're seeing now.
Okay. And can I turn to you? Give us some insights on the hygienist workforce, because I think what Roger is raising is, okay, let's say there's this at least short-term impact on demand that's negative. At the same time, we hear a lot from dental practices, hey, I can't get hygienists back. I need more hygienists. It's like there's a shortage of hygienists. So like what are the key issues you're looking at for the workforce of hygienists, like with this, I don't know, kind of stagnating demand, let's say?
Yeah, Marko, as I was listening to Roger's comments, and as we've talked before, I think about 50% or more of the dental business comes through the dental hygiene chair. So one thing this pandemic has taught our community that dental hygienists have known for a long time, dental practices have to get smart about how they look at their hygiene departments. We know that productivity goes up quite a bit when a dental hygienist has an assistant with him or her, so that the flow of dental hygiene patients can dramatically increase. So when you think about the stress hygienists are undergoing right now in practices, they're essentially in their operatories by themselves. So during COVID and the change to dental hygiene practice of not using aerosol generating procedures, hygienist workload has dramatically increased. They don't have an assistant in there to help with high-speed evacuation. So they're running like crazy to try to keep up. So one big piece I would share with our community is you've got to relook at how your hygiene department functions in your practice. Some of these COVID-19 pandemic stress on providers is significant. So when we look at workforce, of course, we think about both ends. So when you look at the front of the pipeline, we're watching what's happening to dental hygiene education programs. So we have 326 programs in the United States right now, nearly 6 times that of dentists. So will there be a shift in, future students deciding whether they want to stick with the dental hygiene career or not? So the front end of the pipeline we're watching very closely, as well as the shifts that the programs themselves have had to make, particularly in the clinic, all the adaptations, what's going to happen to the hygiene programs. On the other end of the scale is hygienists who had continued to practice 1-2 days a week because they love what they do, they love their practice, and they just weren't quite ready to completely retire. Anecdotally, what we're hearing is that cohort is saying, this is a lot of stress on me, this isn't what I had signed up for, and they're making decisions now to leave dental hygiene a bit earlier than what they had anticipated. So we're watching both ends of that workforce, and I think through our work with your team, Marko, we'll be able to get a much better idea of the stresses that hygienists are going through on a daily basis and whether they make a decision to leave. One last point I'd like to make is that we know there are dental teams who are doing it right. Dentists, as the employer, are engaging their teams in making decisions about how their practice functions. So I think practices who had a good relationship with their hygienists are doing okay. What this pandemic has brought out is the challenges within dental practices when the whole team is not involved in the decision making. So if a hygienist feels that their practice isn't following the protocols, isn't following CDC guidelines, and they're worried about their families and people that they're going to come in contact with, they're making a decision to leave if they don't feel safe. So this pandemic has really taught us how important the true sense of a team really is in order to move forward productively.
Very good. Yeah, and we're excited too to partner with you on that research. And we're also going to be looking at actual COVID infection rates as well.
Correct.
Which is, no studies have been done like that.
Yeah, we're excited for that too.
Yeah. Okay, so you and Roger are both saying kind of the efficiency definitely is a premium, right? Let me shift gears a bit. Candice, let's broaden us out beyond dentistry here. Like when you listen to this, and obviously COVID's brought stress and shock to the healthcare system, right? But are there innovations you're seeing on the broader healthcare side that you think like will really stick? Either scope of practice changes or differences in payment models or telemedicine, you name it. Like what are some things you're seeing?
Yeah, well, first I just have to comment, Anne, as you're describing the issues, the workforce issues for dental hygienists, and I think I'm also hearing you talk about dental assistants. I think that we're seeing those issues play out across healthcare. You could almost lift out dental hygienists and drop in the nursing workforce. Dental assistants, we're probably talking a little bit closer to the long-term service workforce and the many challenges. And what I would point out is that there are immediate COVID challenges, which is around PPE, it's around the point of care testing, it's going to be around vaccines and protecting and people feeling safe in the workplace. But what I also heard you kind of describing is outside of the COVID period kind of magnified it, but there's the structural issues of how we practice, right?
Correct.
And how, as we started talking about burnout, it's not how resilient an individual can be, but it is how much pressure the environment is putting on them, right? And can we reduce the pressure? Can you support your dental hygienist with dental assistants? I would like to make one point, which I also think is really interesting, is you talk about dental hygienists and you talk about dental assistants and actually talk about a lot of the healthcare workforce that we are really paying attention to, that's struggling through COVID, that historically also did as well. We're talking often about our workforce that is often women and minority workforce, right? And COVID-19 has been showing us the inequities, big picture, both in society as well as in our workforce. And And one of the things about the dental hygienist and the dental assistant workforce is that you're about 95% women, right?
Yeah, it's actually 98% female.
Yeah. And so when you're thinking about your workforce and whether your workforce can come to work, it's not just whether or not the workplace is safe, but it is things like when schools are closed, what are they going to do about childcare?
Right.
Can they come back? And it's such an interesting view of dental offices are dependent on their dental hygienist and dental assistant workforce. What does it take to get these people back to work? On the opportunity issues, I think that across the workforce, when COVID first hit, we started seeing blanket waivers coming out of CMS about increasing flexibility to allow telehealth to occur more fluidly, and obviously the payment for telehealth made a big difference. And then we started seeing changes in regulations that were very much about scope and supervision. Then we started seeing states pass emergency, oftentimes executive orders or other, and sometimes legislation around, again, oftentimes scope and how do you maximize the workforce. And I think that there's a lot of questions about what is going to remain from those. Well, there's multiple questions probably. How much did it actually change practice? What is going to remain? And for example, we're seeing the state of California, about 2 weeks ago, the state legislature passed an expanded scope of practice legislation for nurse practitioners in the state. So there's the question of what did those actually do for practice, and are they going to be maintained? Teledentistry is telehealth. Teledentistry is another area. When we talk about how do teams come together outside of scope, outside of regulating how supervision happens, right? Teledentistry gives us this opportunity to change how we practice, right? How do you connect a dental assistant and a dental hygienist back to a dentist when they need it? How do you connect a nurse practitioner, physician assistant, primary care physician who might be out in a rural community back to back to specialists when they need it?
Okay, so general, not to cut you off, Candice, but this is great. So I'm hearing stress and lots of crazy innovations. Like, well, they relaxed HIPAA requirements for virtual consultations. You can do it on your iPhone, right? We'll reimburse for telemedicine. We'll let pharmacists immunize kids. All sorts of stuff seem to be in play, right? And potentially, I was talking with Ann earlier, right? If there is a prolonged hygienist shortage, does that put pressure on, like, okay, who else can do hygiene work? Right? Like that kind of thing. Could it be dentists? Could it be assistants? I don't know. But Mike, let me ask you, are you seeing anything at the state or federal level kind of reflecting this broadening of scope of practice, or maybe not yet, or we don't know?
So I've heard just bits and pieces, but there's no clear, no clear direction I think that's headed in. Okay. At least not that I've seen.
Okay, very good.
And Marko, I wanted to make a point too about how dentists and hygienists work together. When you think about it, we are completely educated in isolation of each other. So who in the world today would create a business model and say, well, let's go educate the two primary producers in a dental practice, but let's have them apart, then throw them back into a dental office and say, now, go work together. No one would do that. Most dentists are completely unaware of all that a dental hygienist can do in their home state. So when you only think about, okay, they do this, they just do this, you're missing the entire scope that a hygienist can do that really improves the health of your patients. And hygienists today, especially, are way ahead of the curve in working in a teledentistry environment. That's happening for hygiene all around the country. So that too is another model of getting hygienists out into the community. So your definition of your dental practice isn't your physical space, it's your whole community. So dentists have to think much bigger and much broader and completely change their business model.
Okay. I'm going to ask you for closing thoughts in a sec, but Chelsea, as we were talking, as you were showing, you highlighted all these differences between dentists in private practice and dentists in public health settings. And we know from our previous waves that holds true for things like whether you kept your job,
Yep.
and whether you use teledentistry, as Anne was talking. I remember the use of virtual consultations / teledentistry was much more prominent in dentists working in FQHCs versus dentists in private practice. But look, Mike, just a quick thing. Can you tell us why? Like, why are we seeing such huge differences in dentists' viewpoints on vaccines or how they practice between private practice and public health?
I'm sorry, that question was directed toward me?
Chelsea. Did I
Yeah.
misspeak? I meant Chelsea. Did I say Mike?
I thought you did, and I was
Okay.
saying why.
All right. Sorry, Chelsea.
Yeah, no, it's a great question, and I think there are a lot of reasons and no clear answer. But one thing is a lot of dentists who are working in public health are naturally working in settings that are already more integrated. So they have, just by their environment, an appreciation for overall health, for the larger healthcare team, even beyond dentistry, and how you coordinate with physicians who are part of your organization. So I think that, and another element of it too is that these organizations, these health centers, oftentimes have the infrastructure to adopt these new practices, to invest in teledentistry and doing it the right way that's sustainable. So there's a lot to be learned from those settings that could make a huge difference in private community-based practices in dentistry.
Okay, but at the same time, would you say, I don't know, my take is there isn't a lot of that migration over into the private practice side, like the, collaboration with the medical community, or, I don't know, it seems like it's separate worlds, but that's for another discussion.
Oh, come on.
But look, I want to turn it back to the panel with closing thoughts, and I just want to ask you, either something you think is a real opportunity that's emerging, right? Or some change or innovation you think will stick or last because of COVID. And on this one, let me start with Anne, and then we'll go Candice, Mike, and Roger.
Yeah, I don't think we're going to go backwards. If anything, the whole of oral health care has changed. I certainly hope we don't go backwards. But what I think is the real opportunity for all of us is to re-look at how that medical dental integration is absolutely vital right now. And hygienists are already doing that. They're already becoming employed in pediatrician practices, long-term care facilities. So they're out there as frontline workers and referring to dentists for the work that hygienists can't do. So I think we have to completely re-look at the oral health care delivery system, and let's go. Let's get it done.
Okay, that's a big one. Good. Candice?
To say something different, but also to kind of get back to the idea of the Medicaid population and high need vulnerable populations and the need that they have for essential oral health care. I would maybe it's an ask to say not to forget those populations, and that in fact that this might create an opportunity. Teledentistry and how we implement teledentistry is a huge opportunity to increase access. It's an interesting question if dentists are going to be down 80 to 85% in terms of service, then Medicaid, while I know there are many challenges in the reimbursement levels that Medicaid provides, are a supported, insured population. And will we start to, is there an opportunity there to, we'll say, smooth and expand our payer mixes, change our payer mixes, even for the individual private practice dentist. So I think that there is need and that there is potential opportunity here.
Okay, quickly, Mike, and then Roger.
So many takeaways from this, but I think one of the things that came out of this whole episode is that directing people to get care and not in a hospital setting, which is part part of something that we began a few years ago at the ADA under Action for Dental Health, and that's, you know, make sure navigating folks to get the care in a dental office and not in the ER or EDs of hospitals.
Okay. And Roger, finally, closing thoughts.
Well, there have been so many brilliant comments, but from the bigger picture point of view, I think the word is integration. If we take all the topics today and the ones you said for the future, Marko, they all integrate. Dental practices will need production to survive and to bounce back. And if hygienists are highly overwhelmed, we're going to get further behind in radiographs, in fluoride, in product sales, in oral home care. There's one example. Teledentistry. I know of 3 companies, I won't name any, that are emerging right now. We're going to see an explosion, Candice, of new companies with teledental, telemedical products. And there are also other uses, like not seeing post-ops. Dentistry had been stagnant in so many ways, and now we're going to see 5 years of change in about 5 months. Do we need to see every post-op, or can that be a teledental visit, opening up chair time for more productive and important procedures, including vaccinations? So my comment would be integration, integrating the dentist, the hygienist, production, technology. And I think we're going to see some very rapid advancement in our profession. I think it's very exciting, actually.
Great. And with that, again, all you are giving opportunities and obviously a real chance to relook and reinvent dentistry. So with that positive note, I want to thank all of you. This has been a great discussion. Obviously, we could have gone on and on. Thank you to the audience, and especially those that submitted questions ahead of time. And we will see you further up the road. All the best.
Thank you.
Bye.